Hey there, Michelle Albino, LVT, VTS in anesthesia and analgesia here, coming to you from my Ask a VTS series. One of the most common reasons I'm called to come help with a patient under anesthesia is to help troubleshoot hypotension. And it makes sense. Hypotension is the most common anesthetic complication observed in veterinary patients. Although blood pressure alone is not an exact indicator of tissue perfusion, it provides the most reliable and least invasive means of assessing cardiovascular status in veterinary patients. So, when you're running anesthesia on a cat or a dog and they become hypotensive, what steps do you take? It is so important to remember these formulas in order to understand why our patients are hypotensive and how to treat them. Cardiac output is determined by heart rate times stroke volume, or the volume of circulating blood. Blood pressure is determined by cardiac output and systemic vascular resistance, or how vasodilated or vasoconstricted your patient is. It's also important to remember that stroke volume is the result of cardiac preload, afterload, and contractility. So, when your patient is hypotensive, either one, their heart rate is too low. Two, they do not have enough circulating volume, meaning either they are dehydrated or have blood loss or inadequate cardiac contractility to form proper stroke volume. Or three, they are relatively hypovolemic, meaning they have the circulating volume but are vasodilated from our anesthetic drugs or other reasons. And often, one or more of these are at play. So, how do you figure out what's causing your patient to be hypotensive and how do you treat it? Start by asking yourselves these questions. Does it make sense to start with a fluid bolus to a cat with a heart rate of 80? Or does it make more sense to give an anticholinergic to support heart rate? Is our isoflurane higher than we'd like because the patient is having a painful procedure and won't stay anesthetized and it's making them hypotensive? Look at the pain management plan and see if you can add ketamine, a fentanyl CRI, or a local block to decrease the gas. Better yet, plan for that ahead of time. Taking a balanced approach to your anesthetic and analgesic plan can help support your patient's whole body when they're under anesthesia, not just their pain management. So, the next time your patient is hypotensive, ask yourself, which of these elements are likely at play? I talk about this concept in detail through my lecture, Intraoperative Fluid Therapy and the Hypotension Algorithm. And I can work with you and your staff to implement this standard operating procedure using the specific medications you have available. You can find me at vetanesthesiatraining.com or on Instagram or Facebook for more information and contact info. Do you have a question about anesthesia or pain management? Contact me and ask a VTS. See you next time.